Hi, my name's Nicola Bonn and I've decided to do a baby vlog. The reason is I had my baby, little Poppy, 11 weeks ago, and it has been absolutely crazy. Like, I never knew, no one ever prepares you, number one, for giving birth, number two, for what happens when this little baby arrives at your house and you just don't know what the hell you're doing. And because I've really wanted help as I've gone, I thought that I'd offer help. So as I learn, I can share it with you and hopefully, you know, help you out a bit. This week, for my first vlog, I wanted just to talk about my birthing experience, the hospital I chose, what was good, what was bad. So I chose UCHL, which is in Euston in London, and really for two reasons. One was sentimental, because I was born there, and the other was because everyone I know, including I've got a friend whose dad is a doctor, and he said that the care you get there is the best. The doctors are the best, and I'm very, very neurotic, and in fact I was very anxious during my entire pregnancy about giving birth and about something going wrong, so I felt I'd be in really safe hands at UCH. So that's where I went. In my first 3 months of pregnancy, I had about 3 weeks of depression, which was, I've never been depressed before, and it was really quite shocking for me to feel that. It felt like a dark cloud, and I just remember thinking that I was never going to get out of it, and it must have been the hormones looking back. But my depression actually coincided with my first appointment at UCH, and it was amazing because I said to the midwife, look, I feel awful, and she actually put me on this path of care where I got this one midwife who looked after me for my entire pregnancy. Her name was Astrid, and she's one of the head midwives. I mean, she's been a midwife since the 70s, and she was amazing. I mean, to be honest, I got through that depression pretty quickly by the end of the first trimester, but I was so anxious about birth. It was driving me mad, this fear. So she really got me through it, talked some sense into me. And actually, I think by the time I was about 28 weeks, I said, right, I'm going to do a natural birth. I can do it. So that was great. So yeah, I gave birth a week early. The reason was, again, it was my anxiety. I went to UCH because I was worried that I couldn't feel any kicking, and had a chat with the doctor, and he actually said, look, you're really anxious, aren't you? And I said, yes. And he did a check, and he said, actually, you could have a sweep now because your uterus is ready. So I said, well, go on. He said, this will bring it on early maybe, and you know, maybe that will help with your anxiety. So he did this sweep, which, you know, I don't know if you know what a sweep is, but they basically kind of put their hands up you and go around the membrane to loosen it. So if you're overdue, often they do that, and it helps the baby to come. This sweep, it felt, I mean, violent's the wrong word. It was very effective though, because he really went for it, and it was really painful. And I actually went into labour 2 days later. So my labour, 3 in the morning, remember, I am petrified. I was really anxious. I woke up at 3 in the morning with this awful, awful pain. Within half an hour, I was contracting every 3 minutes. I phoned Astrid and I said, I think the baby's coming. She said, right, go to hospital now. Arrived at hospital half an hour later, and I was contracting every minute. So I thought the baby was coming, but what happened actually was that I was contracting but not dilating. So they put me on an epidural straight away. I was only 3 centimetres dilated. 19 hours later, I was only 5 centimetres gone. It was really horrible as well, because the alarm kept going off because Poppy's heartbeat was going, and I think this happens a lot in labour, okay? So basically the heartbeat drops a bit, and because they monitor you so well these days, they think, you know, a crash team arrives, 8 doctors arrive, all rush in and check everything and then go out again. And because I was so panicked, this really affected me, and I just had enough. So at the end of these 19 hours, I said, look, I think I need a caesarian. I don't know what's going on, but I think I need one. And this doctor said, look, I think you're right. Let's just do it. Let's just get this done. So went in for my caesarean, and it turned out that Poppy had gone sideways. She was transverse across my tummy, and they really struggled to get her out. It was hot. They actually got her out of my stomach with forceps, apparently. Nightmare. Then Poppy had to go to neonatal because they thought she had an infection. But what I will say is, it was a nightmare, but you forget about it. Everyone said that to me before, and you know, it's a few days, you feel traumatized. I mean, I've spoken to other friends who had natural births and they're the same. It is a big traumatic thing, but you get through it, you're strong because you have to be, and a few days later you're over it. You really are. You need to talk about it, I think. You need to talk about your birth experience. Don't get me wrong, I've got friends who have had what I would call quite an easy time. They just got over it really quickly and they didn't have any pain relief, but for me it was quite traumatic. So yeah, so what I would say is, if you are thinking of UCH, that the care during labour was fantastic. The staff were brilliant. The aftercare in the labour ward, not so good. It was really dirty. I was really shocked. The toilets had blood on the floor and on the sink and near the toilet for 24 hours, and people were complaining and they didn't do anything about it. The night of my birth, 18 babies were born, and there was no one really to look after you, so I was pressing the buzzer because, you know, you don't know what's going on. You've got this baby, you're feeling awful, you're scared, and there was no one coming, so it was very busy. I think actually this is a problem with London hospitals. In the end, we actually were given a private room because it was just so horrible on the labour wards. We were really lucky, but I think it just goes with the territory, and I think the care you get during your labour and also the neonatal care Poppy got was phenomenal. So those two things made up for the fact that the labour ward was a bit grubby and that you know, there wasn't necessarily the care you'd hope for. But if you were thinking of UCH, I would recommend it, definitely. That's kind of my birth story. It's a good place to start, I suppose. I'm going to do these videos every week or maybe more often. I'll introduce you to Poppy and yeah, just talk about my experiences and share them and hopefully help you a bit with things you're unsure about. See you next week.